loud, but I'm not that loud. Yes, I have a business. We just completed our collective bargaining agreement with our employees. And for the last 20 years, we've provided health insurance for them. And every year, it becomes more difficult. And because in this process, when it came down to talking about wages, we had to offer less, and the employees had to accept less than they would like or we would like to give because of the money we had to pay off in health care. At the same time, I have to compete in an industry with other people doing the same kind of business I do. So the cost that I have for my 75 employees compared to another firm means that I have to charge higher fees for the services I provide. And likewise, I can only provide a certain level of wages that perhaps a competitor could provide more because they don't provide health insurance. So my question is, as president, what would you do to take care of this competitive problem?
Do you say you have 75 employees?
Correct.
75. Well, first of all, I think that this plan deals directly with the concerns that you have. We have a competitiveness issue, not only between you and your competitors here in America. We have a huge competitiveness issue, if I can say the word, between our businesses in America and the rest of the world. We have extraordinary health care costs, which you're dealing with every single year in the operation of your business. Those costs have to come down. But in addition to that, what we want is if we have a truly universal health care plan that covers every single American from the time they're born until the time they die. It makes American business more competitive in the world. We're spending $1,700, $1,800 of health care costs on every car that's manufactured in America, compared to about $250 in Japan. Creates a huge disadvantage. What this plan specifically does for your situation is it gives you market power that you don't have today. I mean, individuals and small businesses have no market power, and as a result, you pay extraordinary health care costs. So what we do when we set up these health care markets is we create the same market power for you that exists for the biggest corporations in America. These markets will require competitive bidding to get into the markets, and these private insurers are going to have to compete with a government plan with extraordinarily low administrative costs, 2-3% in all likelihood. So that competition will bring down costs. In addition to that, these things that Karen just made mention of, use of technology, electronic record keeping, preventative care, mandatory preventative care, so that we are healthier, and we are well people, will bring down costs for everybody. So I think sort of the bottom line for you is we will bring down health insurance costs on the whole for what you have to pay. Second, your costs directly will be lower because there will be a level of competition that does not exist today, and you will have a market power that does not exist today. I actually believe that besides the uninsured, who I think we have a moral obligation to, besides the uninsured, the people who will benefit the most from this health care plan are individuals and smaller businesses. I think that you're the greatest beneficiary of this plan.
Well, Senator, the health care problem has been with us for a very long time. The last time a significant effort was undertaken to address it, it never even got to a vote on the floor of either House of Congress because of so many fronts of opposition. And of those, the most important, I think, and the strongest was business. Yeah. So we have a question coming in over email from Mary in Illinois, who wants to know, do you have a strategy for engaging American businesses in achieving health care coverage for all Americans?
Yes, because what we want to do is we want to make American business competitive. We want to bring down the cost of health care, not just for individuals, which we do, but also for American business. And so this plan does all those things. We just talked about it in the context of a small business, but it actually applies to all businesses. What happens is because there are huge cost containment elements of this plan, which I won't go through again, I've gone through, and because we are subsidizing health insurance premiums for low-income and middle-income families, this has the effect of bringing down health care costs for all businesses. The SEIU and Andy Stern had a press conference a few weeks ago with some very large American businesses who were committed to achieving universal health care, which is a very good thing. And well, I believe that actually American business has now figured out that something has to be done about our healthcare system, that it's making them increasingly uncompetitive with respect to the rest of the world, and that universal health care done the right way, with the right choices and the right efficiencies, will actually help American business, not just help the 47 million people who don't have health insurance.
Well, there are going to be candidates who come out here today who suggest that it's possible to do this, to achieve universal coverage without raising taxes, without new sources of revenue. You have been very upfront about the fact that your plan does involve tax increases. Do you think it's possible to get there without them?
No, I do not. We've spent a great deal of time studying this issue, working with health economists around the country. I've spent many months on this. The plan just came out a few weeks ago. My plan just came out a few weeks ago, but I spent a great deal of time working on this issue. I do not believe you can have universal health care without finding a source of revenue. There has to be some additional source of revenue. We don't get universal health care for free. You have to cover 47 million people who don't have coverage. There's going to be a cost associated with the transition from the healthcare system we have today to a truly universal and more efficient healthcare system. So no, I do not believe it can be achieved without finding an additional source of revenue. And the joke I always make about it is that American people have heard so many politicians for so long say, oh, we're going to have universal health care, we're going to transform the way we use energy in America, we're going to end poverty in America, and in the process, we're going to eliminate the federal deficit. They probably got a bridge in Brooklyn they want to sell you too. I don't think it can be done, and I think it's very important, if I can say one last thing about this, I think it is really important, particularly given what's happened in the last 6-7 years in this country, that the President of the United States be honest with the American people, be open and honest. And I think that honesty starts right here in the campaign.
And as you were putting together your health care plan, there are people who argue that the whole idea of basing your health coverage on where you work is just an anachronism. It's a historical accident.
Yes.
You, however, chose to build on that system. Why is it that you didn't, as some people suggested, why did you reject the idea of, say, a government-run Medicare for everybody or some other form of health care that would, again, get rid of a system that is essentially a historical accident?
Well, there's a judgment that has to be made on the front end. It is true that single-payer health care systems in the world dramatically reduce costs and significantly reduce administrative costs, particularly compared to private insurers. It's also true that a lot of people who are listening to this forum like the health insurance they have now and would like to keep it. And my judgment is, number one, to get it done so that we don't spend another decade arguing about whether we keep the system we have now or actually have universal health care. I think this system, my proposal, a truly universal plan and a bold plan, but doesn't go directly to single payer, can be accomplished. I think it can be accomplished politically. I think we can get support from across the political spectrum, and we'll accomplish a lot of what we want to do. Second, it does give people choice. And I think Americans have become accustomed to having choice, and I think they want to be able to choose what their health care plan is. Now, it may be that this gravitates toward a single payer plan because they will have a Medicare Plus choice. And if that's the case, then the whole system could go in that direction. But you'll decide that. Consumers will decide that. So I think actually this plan makes sense in terms of moving us forward, getting a universal health care plan in place, giving people the choice of the equivalent of a single payer plan with Medicare Plus, and then we'll see where it goes from there.
I think we have time for one more question from the audience, and this is on a subject that's very near and dear to a lot of SEIU members. Reggie Werner is an RN from UHS Desert Springs Hospital. Are you here?